The Home Office has also launched an e-learning tool so that all frontline professionals, social workers, teachers, healthcare, border force, police, are able to receive a detailed introduction to FGM. So that's ideal for mental health staff. And the Home Office is also funding training for local safeguarding children's boards, which will be delivered by March. And that's given £100,000 under the FGM Community Engagement Initiative to community-based groups. And I really can't emphasise enough how conscious as all of us who campaign against FGM are of the need to work with the affected community. But I also want to set any minds at rest here who worry that this is not, in some way this is a campaign imposed on communities. Right at the heart of the worldwide campaign against FGM are African women and African women's groups. This is very much a movement led worldwide by African women. And I'll talk more about that in a moment, but I really want you to not feel in any way that you're not working alongside communities affected. It's been one of the most inspiring aspects of my journey on FGM, to see some of those people who didn't really want to talk about it for 4 years. Two of the people I tried to meet with in my constituency 4 years ago are now actually on my local council's task force against FGM. That's how rapid the journey has been. Just turning to the law around FGM, there is changes here in this direction. The first law actually against FGM in this country when it became outlawed was in 1985, but it didn't cover girls taken abroad to be mutilated, and that extension was in the FGM Act of 2003. The government's making changes to that current legislation to further support victims and encourage prosecutions. We are bringing forward legislation to make the law clearer on the liability of parents or those responsible for caring for a child if they fail to prevent the child being subjected to FGM. The government's already included a provision in the current serious crime bill that's going through Parliament at the moment, which will extend the reach of that extraterritorial offence brought in 2003 to close a further loophole, which is to extend it to habitual as well as permanent UK residents. The police have had to drop the police and prosecutors have had to drop at least 2 cases on the basis that that loophole made it problematic to prosecute, so we are moving to close that. At the Girls Summit, which I hope some of you saw lots of publicity in July, we brought dozens of countries from around the world and campaigners from all over the world together to talk about FGM and child marriage. At the Girls Summit, we announced that we bring forward legislation to grant victims of FGM lifelong anonymity from the time an allegation is made. And we're also consulting on a new civil protection order for FGM to work alongside criminal legislation which aims to protect potential victims. And I think that's drawn very heavily on the very successful work of the Forced Marriage Unit and some of the work done around that, which has protected thousands of young women in this country over recent years from being forced into marriage. Following the consultation on those legal changes, provisions for both of those measures will be added to the Serious Crime Bill, which, as I say, is passing through Parliament at the moment, so this is very much happening in real time. And protection orders would mean that courts would be able to make orders with steps included to protect girls at risk of FGM, and that's been widely reported as potential removing travel documents, so a girl can't be taken abroad before the procedure. And many of you, I'm sure you'll hear and you'll find during the workshops, will be aware that the long summer holidays are regarded as a particularly at-risk time. Turning to education then, in April the Department for Education published statutory safeguarding guidance for schools called Keeping Children Safe in Education, and the former Secretary of State also wrote to all schools drawing attention to that guidance and mentioning FGM in his letter. In an early autumn message to all schools, they were again reminded of the FGM multi-agency guidance, which is very good, but until very recently wasn't enormously well known, so we're always keen to promote that, and it's an extremely good place to start to understand the role that we can all play in safeguarding. Following the earlier consultation, the Chief Social Worker, Isabel Trowler, published details of the skills and knowledge that all children's social workers will be expected to possess, and that includes awareness of harmful cultural practices, including FGM. The Chief Social Worker has also written to directors of children's services, local safeguarding children board chairs, and principal social workers, setting out the arrangements that local authorities should have in place to tackle FGM. So one of the things, if you work for a local authority, that you can do when you get back to your area is to just ask about those plans and see how advanced they are and whether those are in place. DFB is also funding 2 voluntary sector organisations, Afruka and the Victoria Colombier Foundation, which work on safeguarding issues, and they include FGM in the ME communities. Education department is also currently assessing bids from voluntary sector organisations for funding through their prospectus grant programme for 15-16, in which FGM is cited as a priority area. Just turning to Department for International Development, and one of the things I think which will also come out today is the extent to which you can't really separate the domestic and the international in FGM. As Nimco and I have both learnt, and many others, and Sarah, you're going to hear from, actually the links between communities here and diaspora communities and communities back in some countries of family origin are very close, and it's very important that we seem to be moving in both directions, and that the 2 strands of work very much inform each other. They won't work if they don't inform each other. So looking to what DFID's been doing, they have set an ambitious aim to see a reduction in FGM by 30% in at least 10 countries in 5 years. And that's the first step on the road to what we all regard as, you know, the absolute end goal, the ending of FGM in 1 generation. And the UK government's committed the biggest ever pot of money for an international FGM programme, £35 million to deliver that work, dedicated money on FGM. That programme of work includes substantial support to the UN Joint Programme on FGM, working in 17 countries. And DFID are also beginning a large research programme, again strengthening the evidence base of what works to end FGM. Because there's lots of theories around there. What we're gradually beginning to do through all this evidence finding and data provision is to really understand what works and what can drive change the quickest. And we can learn a great deal from the Africa-led FGM experience of prevention work and emulate it. As I say, there are some staggering achievements in some African countries in terms of the intergenerational drop-off of FGM, and that has been done in most cases by a combination of safeguarding, education and law enforcement. DFID is also supporting a wonderful social change campaign against, again, African-led, called the Girl Generation, and I would encourage those of you on social media to follow it. It's very inspiring, and it's working again in 10 African countries globally to mobilise and build partnerships and to inspire a movement very much focused on youth. And Nimco mentioned a very, very dear friend and inspiration to so many of us, Efua Dorknud OBE, who was going to be here, who sadly passed away in October. Efua wrote the World Health Organization guidelines, and it was always her dream that we would have an African-led movement by girls, a generation seeking to end FGM in their generation. And one of the last things she did before she died was to put the final finishing touches to that project and hand it over to DFID to launch, and I hope it will stand as a lasting testimony to her amazing work. And that inspirational generation really is there. I mean, I talked about game-changing moments in the last few years. I truly think one of them is the amazing young people we've got in our country. You know, if anybody thinks that, you know, these are girls who are, you know, staying silent, not at all. I mean, there's a couple of groups I would pick out. We know very well the group from Integrate Bristol. If those of you who haven't seen their marvellous video, well, marvellous apart from my dodgy dancing, which features 2 minutes in, shut your eyes. But they did a wonderful video if you just put in Integrate Bristol, use your head into YouTube. It's a great thing if you're doing anything with young people. It's a great way to begin or end a session, because it's a really fabulous, upbeat sort of tune and video. But the message is very, very clear. And those young people have been doing amazing work. And actually Bristol, as a city, has done some fantastic integrated work. So I do encourage you to look at that and pay tribute to their work. I also met a new group that I hadn't come across, bizarrely in a park in Wandsworth over the summer at a young suffragettes meeting. These fantastic girls, about 16, 17, mostly from the sort of British Somali community around Hammersmith, and they call themselves Made Perfectly, and their strapline is "We're made perfectly, don't alter us." And they have been going out with a big old homemade banner in Hammersmith Shopping Centre, getting people to sign up to a petition. And this is amazing bravery and inspiring action by these young people, because it is not easy to do that if you're from a practicing community. And I just think when we look at what they're doing, we owe it to them to step up to the plate too. We need to keep these girls safe. We need to work with them directly and with local practicing communities. At the Girls' Summit, we launched declarations against FGM as a government. They've now been signed up to by over 350 religious leaders from all major faiths, and they made it clear, as we've heard at numerous conferences, that no religion condones the practice. There is no scholarship to support it. Just briefly, the Department for Local Government, Communities and Local Government is also providing £270,000 of FGM funding to support frontline projects across England to help stop FGM and honour-based violence, and again involving survivors and community groups very broadly in that. We launched the Statement Opposing FGM leaflet. I've forgotten my prop, but I'll wave one a bit later. But many of you have seen it. It's a very small little thing, sometimes known as the FGM passport, the health passport. I will wave one in a moment, but they're really important if you haven't seen them. Particularly important for teachers and health GPs in the run-up to the summer. It was interesting, when the Home Office launched it, I did a speech on it when I was at the backbencher, and the Home Office launched it. It was a Dutch idea originally, but it's a very simple document issued in 11 different languages that girls and parents who don't want their daughters to be mutilated can carry with them abroad, and it makes clear the law and the fact that the law extends abroad. And then again, as evidence of how things have changed, when we launched it, we were kind of trying to promote it, whatever. We ran out this year. I mean, we had to reprint it. And when I went into one of my local GP surgeries, they said so many people coming in, families were saying, "Can I have a handful to take away with me?" And that was fantastic. And they were really impressed that people were actually asking for it. It's a small thing, but again, it's just a really useful thing. The multi-agency practice guidelines were updated in 2014. They touch on a lot of the risk factors that many of you working in this room should be looking out for. They're very helpful to read. And the Home Office public consultation that launched on Friday is also consulting on putting them on a statutory basis, so we would like your views on that. I hope I've given you a sense that we're taking as a government wide-ranging action and a really thorough approach to eradicating FGM. Everyone there has a part to play. We can't just do it by issuing policy guidance, and no single agency can do it on their own. We need to really do that joined-up approach. We need to work internationally to make sure that any work this government does is also being truly effective abroad. We couldn't have done it without amazing support and cooperation from so many stakeholders, colleagues, local campaigners, and those of you who've been involved in that in this room, thank you very, very much. We know it's not a field without its challenges, but having the knowledge and the confidence to do the right thing is absolutely, we think, the best place to start, and I sense that that is happening. So I have a couple of challenges for you, threefold in fact, my challenges to you as you return to offices and workplaces after this conference. If you or your colleagues identify a girl at risk of FGM, are you sure that you have developed an appropriate safeguarding response which you can follow to protect her? What services are you or your colleagues commissioning in your area, and what is the evidence base that you're using to do that? And how is your organisation ensuring that all your colleagues are suitably trained? Please don't leave it for someone else to raise this. Please make sure you're the person doing it. I mentioned before that there's a fantastic group in Bristol called Integrate Bristol, and in that video, the opening of the song, the words are, "Do you hear that sound rising from the silence?" Well, FGM is silent no more, and we must make sure in all parts of our nation it is silent no more. Thank you very much for being here. Thank you for the good work and the vital work that I know you're all going to do. And as the late wonderful F used to say to us all, if you do it right, generations of girls will bless you.